Hello, let's take a look at the parathyroid hormone analysis in the FNA samples. On ultrasound, the normal parathyroid gland is often seen as an echogenic nodule in the lower part of the thyroid gland. A cyst was seen in the lower part of the thyroid gland on ultrasound. If you look closely, you can see an echogenic portion on the periphery of the cyst. The finding raises the probability of parathyroid lesions. Let's look at it in a clip. This patient was referred for FNA due to a thyroid nodule at the outside clinic. The first FNA result was atypia. At the time of the follow-up FNA, I performed an ultrasound on the patient. I did an FNA with a parathyroid hormone test at FNA washouts because the lesion can be a parathyroid lesion. The lesion can be diagnosed as a parathyroid lesion based on a high parathyroid hormone level at FNA washouts, although the FNA result was benign. As you can see, it is difficult to distinguish between thyroid and parathyroid lesions by cytology. On a parathyroid scan, there was an uptake at the lesion. The parathyroid adenoma was diagnosed pathologically. Serum parathyroid hormone was high before the operation. It was normalized after the operation. This is the other patient. There is a solid hypoechoic nodule below the thyroid gland. A parathyroid lesion was diagnosed based on a high parathyroid hormone level at FNA washouts, although the FNA result was benign. He suffered from recurrent ureter stones several years earlier. It's very simple to do the parathyroid hormone level test at FNA washouts. I showed you a video that was to test the thyroglobulin level at FNA washouts when lymph node metastasis from thyroid cancer was suspected. It was the same way that remained aspirates were rinsed with 1 cc saline. In summary, the parathyroid hormone level test is recommended at FNA washouts because it is difficult to distinguish between thyroid and parathyroid lesions by cytology. If you can consider the lesion to be a parathyroid lesion. However, if the possibility of parathyroid lesions such as hyperparathyroidism is clinically certain, we do not recommend FNA for the lesion. After FNA of the parathyroid lesion, severe fibrosis, adhesion, or inflammation may occur in surrounding tissues, making it impossible to perform minimally invasive parathyroid surgery. Sometimes, there are reports that the possibility of bleeding increases due to fibrosis caused by FNA at the time of surgery. Thank you.